How does cervical cancer recurrence affect treatment options? When cervical cancer comes back after initial treatment, it can be a confusing and worrying time. The options for managing recurrence depend on several important factors. Doctors look at where the cancer has returned, what treatments the patient has already had, how far the disease has spread, and the person's overall health. Each case is unique, so treatment plans are carefully tailored to give the best chance of controlling the disease and maintaining quality of life. If the cancer recurs only within the pelvis and the patient has not previously received radiation therapy, radiation treatment combined with chemotherapy is often the first choice. This approach can help control the tumor locally and may improve survival chances. However, if the patient has already had radiation before, repeating it becomes more complicated. The tissues may not tolerate more radiation, and the risk of side effects increases. In these situations, doctors might consider surgery, different chemotherapy drugs, or targeted therapies to manage the recurrence. When the cancer spreads beyond the pelvis to distant parts of the body, systemic treatments like chemotherapy are typically emphasized. Combining chemotherapy with surgery or radiation can sometimes help extend survival or relieving symptoms. The goal in these cases is often to control the disease and improve the patient's comfort, rather than cure. Treatment options for recurrent cervical cancer include radiation therapy, which can be delivered externally or through internal brachytherapy. Radiation is effective for local control and symptom relief, especially if the recurrence is confined to the pelvis and no previous radiation has been given. Chemotherapy drugs such as cisplatin, carboplatin, paclitaxel, and topotecan are used alone or together to target widespread disease. Sometimes, chemotherapy is combined with radiation in a process called chemoradiation to boost effectiveness. Surgery may be an option in specific cases, especially if the recurrence is limited to the pelvis and radiation is not suitable. Procedures like pelvic exenteration, which involves removing affected pelvic organs, can sometimes be performed with curative intent. Additionally, newer targeted therapies like bevacizumab and immunotherapy drugs, such as pembrolizumab, are being used to treat advanced or metastatic cases, often alongside chemotherapy to improve outcomes. Previous treatments, especially radiation, greatly influence what can be done at recurrence. Reirradiation is often risky and may not be possible, so doctors might turn to chemotherapy or surgery instead. The presence of scar tissue or altered anatomy from earlier treatments can also make certain options more challenging. The main goals of treatment are either to cure the cancer or to improve quality of life. When recurrence is localized and the patient is healthy enough, more aggressive treatments might aim for a cure. In cases where the disease has spread widely or the patient's health is fragile, treatments focus on easing symptoms and maintaining comfort. Because every case is different, treatment planning involves a team of specialists including oncologists, surgeons, and radiation experts. They work together to weigh the potential benefits and risks, always considering the patient's wishes and overall health. It's important to remember that while recurrence can limit some options, many treatments are available to help control the disease and support the patient through their journey. Always consult with healthcare professionals to determine the most appropriate plan for individual circumstances.